Hello, and welcome to the third and final workshop of our Impact Wellbeing Guide series. Today, we'll be talking about building and sustaining a system where healthcare workers thrive. During today's session, we will start with welcome and introductions. Then we will quickly review key takeaways from workshop 1 and 2 in case you were unable to join us. From there, we'll dive into the final actions of the guide and learn about integrating professional well-being into quality improvement and developing a long-term professional well-being plan. Afterward, we'll facilitate a Q&A with our speakers, hold a closing keynote, and then officially wrap our series. Please note that today's session will be recorded and will be available on the Impact Wellbeing website. I'd like to introduce myself. My name is Stephanie Simmons. I am the Chief Medical Officer of the Dr. Lorna Breen Heroes Foundation, and it has been my pleasure to work alongside CDC and NIOSH on the Impact Wellbeing Guide. If you'd like to learn more about the Dr. Lorna Breen Heroes Foundation, the link to our website is in the chat, and we always welcome engagement from all of the members of our community. We have a wonderful panel of speakers today who I have the pleasure of introducing. We'll be using first names to refer to our speakers without titles to model the culture that we're aiming to see. We have Elizabeth Liz Harry, the Chief Wellbeing Officer at Michigan Medicine, Gaurav G. Agarwal, Vice President and Chief Wellness Executive at Northwestern Medicine, Jennifer Jen Berliner, Director of Physician Wellbeing at UPMC, John Howard, Director of NIOSH, Kimberly Kim Piers, Vice Chair of Clinical Affairs at the Department of Medicine, Johns Hopkins School of Medicine, and Paul Rains, Systems Senior Vice President, Behavioral Health, Common Spirit Health. To share a bit about the guide before we dive in, NIOSH, in partnership with the Dr. Lorna Breen Heroes Foundation, developed the Impact Wellbeing Guide, which includes 6 actions that hospital leaders can take to improve professional well-being. The guide was real-world tested in 6 Common Spirit hospitals across the U.S. from July 2023 through December 2023. The guide then went through a lengthy revision process after testing with Common Spirit to ensure that the content was clear, actions were achievable, and that we were providing the right range of tools and resources for leaders. The guide was publicly launched in March of this year and is included in the overall suite of materials available as part of the NIOSH Impact Wellbeing campaign. There will be links in the chat about the Impact Wellbeing Guide and to learn more about NIOSH. As we mentioned, the guide includes 6 actions that leaders can take. The actions are designed to build on one another and help the hospital integrate professional well-being into existing systems and operations. Before we dive into actions 5 and 6, which is the focus for today's session, we wanted to briefly share what we discussed in our first and second workshop so that if you were unable to join us, you can better understand how these actions build on one another. Workshop 1 focused on the first 2 actions, reviewing your hospital's operations and building a professional well-being team. We discussed how action 1 is more about learning what is currently happening in your hospital and how it acts as the foundation to the well-being work. Completing action 1 equips you with a high-level summary of the efforts that are already underway so that you can build on what is already excellent in your organization. And it builds trust through shared governance. Nothing about me without me. In action 2, we discussed how building a professional well-being team establishes who will lead efforts in your hospital to support professional well-being. It provides 3 different team models for professional well-being and underscores that professional well-being work can be done prior to identifying a chief wellness officer role. In our second workshop, we focused on actions 3 and 4 of the guide, breaking down barriers to help seeking and communicating your commitment to professional well-being. Attendees of Workshop 2 learned that Action 3 provides instruction to eliminate invasive and stigmatizing language from credentialing applications and peer review forms. It ensures that healthcare workers have confidential access to mental health care and normalizes mental health challenges. And in Action 4, we outlined a plan for communicating with staff about well-being work. We emphasize that staff are empowered to help or become involved when there's leadership buy-in and communication about well-being work, and created opportunities for staff to provide feedback and really understand that their feedback is being heard and used, and that it's being communicated back to them that it's heard and used so that they are more engaged. In the chat, there will be a link for tips for stigma-free communication about mental health. So with that, let's talk about the final 2 actions of the guide and start with Action 5. The purpose of Action 5 is to integrate professional well-being measures into an ongoing quality improvement project at your hospital. This step is to ensure that the workforce can do their jobs while limiting administrative and operational burdens. This action draws on Quadruple Aim quality improvement, which we'll discuss shortly, and recognizes professional well-being as a key outcome that is essential to improving your hospital. As part of this action, we want you to gather information about current burdens at your hospital, identify an existing quality improvement project, and add professional well-being measures to that project. This action helps you to consider the impact on your workforce when undergoing any quality improvement project, and to recognize that workers are at the center of the healthcare system. The guide will be available in the chat, so if you want to have Action 5 up and ready to follow along, please follow the link in the chat. To achieve the action items set forth in this section, the guide offers 2 resources: the Quadruple Aim Quality Improvement Guide and list of professional well-being measures. We've popped links in the chat, so if you're you're able to access those and to follow along. If you have any questions about these resources, we encourage you to pop them in the Q&A function. Using the Quadruple Aim Quality Improvement Guide to choose an ongoing QI project not related to well-being, and to identify which quality improvement indicators related to well-being you can integrate into the project. The quality improvement guide really helps you to integrate those pieces into an existing project. So you can fill out this sheet together with your patient safety and quality team, or you can use the questions to start a conversation. As you look through the materials, I encourage you to use the chat and to brainstorm what current projects you think you could integrate professional well-being into. All right. I mentioned Quadruple Aim quality a moment ago, and I want to expand a little bit on that. While Action 5 focuses on adding professional well-being through the Quadruple Aim, it's important that we recognize a new framework as well, the Quintuple Aim. Quintuple Aim quality improvement incorporates human factors into the Triple Aim model, considering professional well-being and health equity as key necessary elements. If you're familiar with this model, we'd love to see thumbs up reactions, or feel free to discuss more in the chat as a group. For some background, since the Institute for Healthcare Improvement introduced the Triple Aim, experts now encourage hospitals to adopt Quadruple Aim quality improvement. It adds professional well-being as a 4th dimension critical for improving hospitals and health systems. Systems often center patients appropriately, but must also recognize that there are 2 other groups of people at the healthcare system: patients and healthcare workers. Quadruple Aim quality improvement is a framework to ensure that quality improvement projects do not compromise professional well-being, and to measure the impact of these projects on the workforce. So if we expand on this model, Quintuple Aim incorporates health equity as a 5th element to quality improvement. Many widely acknowledged disparities affect patient outcomes. These are caused by a variety of social determinants of health. So it's important that you set health equity standards and consider the greater social needs of patient populations through the quintuple aim with your well-being work progress. So at this time, we're going to launch a poll to get a sense of where you feel your hospital is focused right now within this model. I'm going to give folks a minute to respond here as well. And you'll see that these 5 choices for the poll correspond to the 5 aims of the quintuple aim. Okay, we can see where our respondents fall here in just a moment. Thank you. So it looks like the majority of folks are focused on patient experience, population health, and reducing costs, with about a third looking at care team well-being and about a fifth looking at health equity. Thank you for sharing that. All right. To think about how we can incorporate all 5 aims, I'd like to share an example that incorporates quadruple and quintuple aim outcomes. So let's imagine, for example, and I know that this will be a stretch, that the patient care staff report feeling burnout because they are spending too much time on administrative tasks related to the EHR. We use this as an example because it is a consistent theme when you ask healthcare workers what is their largest source of administrative burden. It is often the EHR. So as an action, your professional well-being team representative and your patient safety and quality team decide to focus on the ongoing integration of the EHR system to increase efficiency. If you are looking at a triple aim outcome, that would look like improved billing capture and patient follow-up visits. Okay. To add a quadruple aim outcome, you would do those things as well as reducing inbox message burden on workers. Okay, streamlining the experience of providing care. And to add a quintuple aim outcome, you could then data match to patient populations to target interventions so that patients across your population have equal access. This is not an either or situation. It builds, and it's an and situation to really focus and improve overall access to healthcare and the experience of all people involved. So at this time, I would like to invite Liz Harry and Kim Pierce to the stage, and we are going to have a discussion of step 5 together. Liz and Kim, thank you and welcome.
Thank you for having us.
Thanks so much.
So you are both intricately involved with looking at the quadruple and quintuple aims in your organizations. What quality improvement projects have you incorporated professional well-being concepts and measures into? And Liz, why don't we start with you?
Yeah, thanks so much. And, I think it's such an important question. And what I love about the quintuple aim and the way that it's framed is it really gets clearly at the idea that we're all actually solving for the same thing. We're all trying to create an environment where we can deliver care in a way that provides a certain quality and a certain environment and allows those delivering the care to succeed in a certain way. So I love the idea. And to that end, I think it's important to realize that any project we do in any of those domains really cross-pollinates and could be a project for all the other domains. And so I think thinking about all of our quality improvement projects as wellness projects, but also health equity projects can be, well-being projects and so on and so forth. One of the projects that I love and have been really impressed with that was done here was by our Improve team. So it was a Michigan program on value enhancement. And what they did was they used implementation science to develop a predictive model for physicians' assistants' decision-making and patient scheduling. And this was a process that was very repetitive and kind of onerous for our physician assistants, specifically in surgery scheduling. And the project targeted patient screening with defined risk factors to enhance appropriate scheduling practices. They used implementation science and built a model to predict decision-making by physicians' assistants when scheduling patients, and then had human oversight. And it really improved the experience for our patients in the scheduling process. It improved safety outcomes in terms of where people were scheduled and appropriate procedures being scheduled at the right place. But there were also time savings achieved and improved patient clinician connections regarding care through this newly optimized schedule. And they got a lot of qualitative analysis that it really improved people's work-life balance. So I just love this as an example of an intervention that really could hit on so many of these different aspects.
Thank you, Liz. It's a great example of something that's good for patients, good for healthcare workers, and good for outcomes. Kim, how about you? What is a quality improvement project that you think sort of marries professional well-being as well as other measures within your organization?
Yeah, I would first just like to echo what Liz said about how the overlap of all those domains is so important, right? You can't really unwrap one from the other, and to make it, ideal, you always want to layer the health equity component in. In reflecting on this, I think we did a quality improvement initiative very tightly aligned with our well-being office on prior authorization burden. And for those of the non-physicians in the group, prior authorizations are when insurers initially deny medication requests and then further paperwork needs to be done, which is usually on the backs of physicians or nurses, somebody at the clinic level. And so we set out to try to support our primary care clinics who were really feeling the burden of this at the expense of other, what they felt more meaningful direct patient care initiatives that we really felt strongly about achieving, and centralized. So again, it was falling at the level of the clinics. We came up with a model to centralize a prior authorization support system through working with our pharmacy and pharmacy tech group. So this is a specialized subgroup of pharmacy techs who like doing prior auths, quite good at it, standardize it, and to take that burden that we really had the signal from the clinics was overwhelming, and to the point where staff were wanting to leave because it was just too much work. And we layered on sort of the well-being assessment when we did pre and post intervention assessments, and asking about quantitative components of it as well as qualitative components in assessing burnout scores, pre and post intervention, as well as time spent doing the effort. So, asking subjective reports from those that were doing the prior authorizations, how much time they were spending, and then we're able to have them reflect on that post intervention. So in addition to some very quantitative components of the numbers of prior authorizations, we garnered some quantitative well-being components as well as qualitative.
So you looked at time reduction with the new process, and then it sounds like you also did a pre-post survey around how staff were feeling about the process. Is that right?
Yes. Yeah. So we did a as a general screening for burnout. Workplace exhaustion was a component of that they particularly scored poorly on, which actually we did see an improvement post-intervention. We also asked about time spent doing this work that they felt not value added, pre and post, and that was reduced. And then we tried to objectively get information from our EMR, how much time was being spent, which we realized was hard because there was not a standardized format for which people were doing it, making data harder to pull. So through this intervention, we standardized the workflow so that we could actually objectively find out how much time it was taking, so that we could reflect to our hospital leadership, this is a lot of time. So we actually added data in that we probably didn't have when we started.
It's a great point. Sometimes to be able to quantify the impact of these interventions, we need to be really thoughtful about how we're measuring and what we're measuring. Liz, what advice would you have for hospital leaders as they select well-being KPIs for their quality improvement projects? Are there any indicators that you've found particularly meaningful?
Yeah, I mean, I think there's a lot of indicators out there. I think one of the important principles is thinking about whether you're using process measures or outcome measures. I think it's tempting to want to use outcome measures and say, you know, how are we changing engagement or professional fulfillment? But I think that we are at a space in the field where we really need to focus on the process measures. I really like the way the National Academy of Medicine has really set their key priority areas and has their change incubator sites reporting on process measures, on the processes they're doing to address those key priority areas. And so I think if we can think about what behaviors do we want to incentivize our middle leaders to be able to do to really create this culture that supports the quintuple aim, you know, what behaviors do we need them embodying? You know, we need them routinely looking at the processes and policies and procedures and streamlining them and looking for waste and redundancy, looking for ways to provide better care and streamlined systems. So it could be as simple as, you know, each service line, each clinical area, you know, needs to complete a project in one of these spaces, you know, with this time cadence and report out on it. I think what's nice about that is it gives us the opportunity to learn from bright spots, you know, to learn from areas that are doing well and doing creative things, and to see the impact that different things have on engagement.
So really, you know, embracing those positive organizational strategies to look for spots of brilliance and intensify them, and not only look at a gap analysis. I love that. So Liz, as hospital leaders are integrating professional well-being measures into their hospital quality improvement efforts, how would you recommend that they engage with the workforce?
Yeah, so there's this phrase that's used a lot. I don't know who coined it, but it's, you know, nothing about me without me. And I love it. And I think, you know, I was just in sort of an experience meeting all morning where we were talking about this closed loop communication. And there's so many novel ways to try to do that now with crowdsourcing applications or other opportunities to really get the finger of the pulse of the front line. I think that we need to have a much stronger bi-directional communication flow with the front line to make sure that we understand not only what the pain points are, but how they would solve it, because they understand how to solve it better than anyone else because they're living it.
That's right. The people who are often best equipped to tell you how something needs to be fixed are the folks who are doing the work every day. Absolutely. Kim, thoughts on leaders engaging the workforce to integrate professional well-being measures?
Yeah, no, I think that the most important thing is sort of safe space and common ground, right? And so, you know, what I found helpful is we have a quality safety based approach at a clinic or a hospital unit level. We call CUSP is the acronym. But the intent of that is that everybody's voice is equal, right? My voice is no more important than the CMA or you know, the tech on the floor. That everybody has input, it's heard equally. It's a respectful situation, and I think that's where you get a lot of the signals of what's not working, what's frustrating people. As I said before, people don't like it when it's not, things aren't efficient. People like things to be efficient. It makes them happy. And so to try to get those signals of where we can operationally improve, because I really think that often reflects how we can improve well-being, or at least focus on that. And so we have gotten a lot of good ideas from those groups of what's not working and where, and then, you know, it's always the canary in the coal mine, because you hear it there and, you know, across the institution, people are feeling the same thing. And so it's a lot of listening.
Great. A lot of listening. Healthcare work is hard, and there are parts about it that will always be hard. So by listening to our workforce, we can think about the parts that don't have to be as hard as they are and make them better. Both of you have given extremely valuable examples of how this works, how organizations can meet the quadruple and quintuple aim. Thank you for joining us, and we'll see you back for the Q&A session at the end. All right, we are going to move on to action 6. The purpose of action 6 is to develop a professional well-being plan. This step is essential to sustaining your hospital's commitment to professional well-being. It helps your team stay accountable, on task, and mindful of healthcare workers. And the needs of healthcare workers that go beyond the initial actions in this guide. So as part of this action, we want you to meet with your professional well-being team and select goals that will fill a need in your hospital, to build a plan and then share this plan with your staff. So when developing goals, consider the following topics: workplace violence and harassment. So think about how to help healthcare workers feel safe by ensuring that their well-being is valued as much as patient satisfaction. Staffing, adequate staffing can improve both worker and patient safety. And health equity. Staff from racial or ethnic minority groups may experience burnout differently and have different communication needs to consider in this work. With action 6, we provide one resource, which is a well-being plan outline. There's a chart for you to populate, and it helps you identify what goals your professional well-being team will accomplish over the next 3, 6, and 12 months for each goal category, including individual support goals, measurement goals, and operational goals. And we are putting the link for that resource in the chat right now. So in this step, you're going to select the goals that will fill a need in your hospital. The first area is individual support, which is focusing on improving individual professional well-being. The second is a measurement goal to focus on continually assessing professional well-being. And as Liz said, that includes the process measures and the outcome measures. And the third area is operational improvement, or focusing on implementing operational changes that support professional well-being. For each of these categories, you're asked to list your goals by intervals of 3, 6, and 12-month timeframes. Individual support goals could be something like building a peer support network, for instance. To help assess the professional well-being of your staff, draw upon the many pre-existing resources out there. There's no need to reinvent the wheel on this one. My colleagues will pop a few in the chat for you all to use, but there are plenty of others listed in the guide, including the NIOSH WellBQ. And lastly, operational improvement goals could involve training on quadruple aim quality improvement and integrating well-being KPIs into your quality improvement projects universally. To achieve these goals, lean on your professional well-being team to carry them forward. As your team matures and the work matures, you will have opportunities for many different projects in these areas. And at this point, I'd like to welcome G. Agarwal and Jen Berliner to the stage to discuss how their organizations have done this work. G and Jen, welcome.
Thank you for having us.
Thank you.
So I'm going to start with a more of an overview question. And what goals did your hospital or health system decide to include in its long-term plan for professional well-being? And a little bit of how did you get there? So what goals and how did you get there? And let's start with G.
Thanks, Steph. For us, we wanted to create a long-term plan in Northwestern that we call NM 2035. And so it gave us a little bit of a head start of about a decade to continue to think about what we want to accomplish, particularly in well-being. And we wanted to really take a page out of the book of the National Academy of Medicine's national plan, step 1, which was centering the work environment. And so our goal, our organizational goal and pillar is providing a superior work environment that promotes well-being. really with the idea that the environment is really what we as an organization owe to our workforce, that can help make sure that this work is sustainable and delivers meaning. For us, we divided that larger goal into sort of three buckets that we call the work determinants of well-being. And so as a part of providing a superior work environment, we thought that we could make sure that we address where we work, under which security, safety, and belonging, the issues you mentioned, are encompassed. How we work, how do we think about technology? How do we use technology effectively? How do we think about autonomy, flexibility, rest, and recovery? And then the final bucket is how we invest, engage, and develop. So thinking about professional development opportunities, compensation, benefits. And so this takes a page out of the book of NIOSH's Total Worker Health, where we really highlight this idea that the policies and procedures of how we design our work are really what are going to be central to improving our organizational well-being.
Thanks, G. NM 2035. Got it. Jen, can you share a little bit about how your hospital decided to on their long-term goals and what that planning process looked like?
Yeah, thanks, Steph. Thanks for having me today. So our main goal, and it kind of sounds a lot like G's, is to make our organization the most desirable place to work and to define our organization as a leader in combating burnout for all our healthcare workers. So with that main goal in mind, we have decided to use survey data to inform the work that we're doing. So we measure burnout and professional fulfillment for all our physicians and APPs, as well as the drivers. And based on that, we follow the Stanford model. So similarly, we have three buckets that we look at. We look at personal resilience, efficiency of practice, and culture of well-being. And we use process measures to try to achieve that main lofty goal of being the best place to work. So I can give you some examples. So some of the initiatives that we've developed to hit these goals are, for example, in the personal resilience bucket, we've developed something called Curbside, which is a concierge program where any physician or anyone who lives in their home can call during daylight hours and share as much or as little information about the specific issue and receive a warm handoff for mental health care providers, which has been enormously helpful both pre-COVID and during COVID, when it's been harder to obtain a mental health care provider. In the bucket of efficiency of practice, most recently, we have implemented ambient AI throughout our system. So we provide ambient AI for any of our clinicians who'd like to use it, but we're trying to be strategic about that and prove the value. And so from a well-being standpoint, we're surveying and evaluating the use of the ambient AI, if it's helping people, both using quantitative and qualitative measures. So we're looking at professional fulfillment, burnout, how user-friendly the electronic health record is prior to using the ambient AI and after. And finally, in the culture of wellness bucket, we have developed a physician peer coaching program, both to teach our leaders coaching techniques to interact with all of their colleagues and lead with those skills, as well as providing a peer coaching program for any of our physicians who work at UPMC to obtain a coach and develop a coaching relationship free of charge, kind of like a benefit of working at the organization. So lots of process goals to achieve our overall goal of improving well-being.
Thank you. You know, it's interesting. There's a little bit of convergent evolution here in how organizations are looking at how to do this in a way that's comprehensive, right? And that's not by accident, because these areas are the main areas that impact the professional well-being of the healthcare workforce. So it's really nice to see how different organizations are breathing life into that framework to really make a difference. It's always interesting to see how these things come together in an organization. And so as you are articulating your strategy, I know that there's a lot of work that goes into that strategy production. And I'm curious, Jen, maybe you could talk a little bit about the steps you took and how long it took to develop your strategy.
Yeah, I'd be glad to. So we survey, as I said, using the PFI, the Professional Fulfillment Index, and we decided to survey every other year. And I bring that up to say we do that so we have enough time to digest the data, interpret the data, make action plans, and then iterate on it before we start surveying again, because there's nothing that people like less than to be surveyed over and over without seeing any change. So we look at the data and we develop action plans. A lot of times, in addition to surveying people, we will take small groups and do focus groups using a nominal group method to really make sure we understand what we're hearing and really integrate the feelings and the ideas of our clinicians as we develop our action plans to make sure that, you know, like Liz had mentioned earlier, we want to make sure we're listening to people and asking them for the solutions or giving them a voice because they really do know how to make change. And we really involve 3 major groups as we develop our goals and our process. We involve our executive leadership team to make sure that they have a voice and that most importantly, we understand the goals of the organization so we can align our well-being work with the goals of the organization to be the most effective. We have a champion well-being group. So we have champions in all of our large academic departments throughout the system. And they really help us to hear the voice of our practicing providers and clinicians. So it's a really nice feedback loop. We hear from our clinicians and our champions about what's going on at the ground level. And we also hear from our executive leaders about the goals of the organization. And so we're able to be a good resource to communicate all of that information and develop our goals based on all of that information. And finally, we have a steering committee of well-being experts who work and are employed at UPMC. And so we obviously rely on their expertise as well.
That's great. So it's really a 360 view of the organizational needs. Thank you. G, what did the process look like at your organization for developing your plan?
Yeah, very similar. And I would say that it's also a continuous improvement process. So we're constantly iterating and tweaking. But for the NM 2035 plan I mentioned, it took about a year doing the exact same process. The Jen highlights really using sort of the Institute of Healthcare Improvements model of senior executive leadership, middle managers, and frontline workers internally. And then I think we also really wanted to be evidence informed. And so externally, we looked at consultants, we looked at the frameworks that have been put out there by experts as well to sort of integrate the best science and best knowledge that we currently have on how to address this problem to come up with this plan in a way that also fit our culture. I think that's important. You know, they say if you see one well-being program, you see one well-being program, and I think that's right, because if it doesn't fit with your culture, the thing that I'm most excited about with this conversation is it sounds like we're not putting wellness to the side. It's not a thing we do. It's being embedded into our operations at our institutions, and how that looks at each of our institutions is different. And so it's important that you do embed it in this work if you want it to continue to make a difference in the really core ways that our workers are asking for.
Absolutely. Part of the fabric woven through warp and weft. How has committing to this long-term plan benefited your workforce and your hospital's organization? So any examples of sort of tangible change and benefits that you've seen? And we could start with you, G.
I think what was so important for us, is particularly as the inaugural role of Chief Wellness Executive, the creation of an Office of Wellbeing for our entire workforce, was that as we were going around for our initial listening sessions, you would ask people what they thought, what they needed from a well-being perspective. And we just got, you asked 10 people, you got 10 different answers. And that was super intimidating from a leadership perspective, an organizational strategy perspective, to say, well, how can I meet the needs of various workers? And so for us, creating the organizational strategy, defining what our organization is going to pursue, has allowed us to have a very clear shared vocabulary about what is it that the organization is committed to its workforce on. What is the Office of Wellbeing going to work on, and what is it not going to work on as we advance this strategy over the years? And so for me, I do believe that has been the single biggest thing. And it takes time. We still get lots of requests from various leaders, middle managers, and say, hey, can you come and do a mindfulness workshop? I'm a psychiatrist, I'm a coach, I love mindfulness, but that isn't what the Office of Wellbeing is singularly focused in on. And this framework allows us to help explain what we do and what we were going to work on and how we can best be a partner to you in advancing that mission.
One of my gifts to a mentee early in my career was a no button, right? You press it and it says no, like 5 different ways, because what we say no to is as important as what we say yes to. Is what allows us to get the work done and to focus. So I appreciate that insight as well. And G, because I know you're saying yes to an awful lot in your organization's work. Jen, how has committing to a long-term plan for well-being benefited your organization?
I think this has definitely been a journey for us at UPMC, and I would say that committing to these goals and this plan has been really impactful because people know that we're going to continue to do this work. So we've committed to surveying every other year and then doing something about the results, which I think is really, really impactful. We know that we have an office that's set up, and so we are going to move this work forward. So I can give you an example. Over COVID, we did see a reduction in our burnout levels and an improvement in our professional fulfillment levels. And we continue to work really hard and take this data that we're receiving seriously. So people fill out the survey because they know there will be some action. The only other thing I would like to say is it's really been culture changing. You know, when you start doing well-being work at a large organization, it's hard for people to take it seriously and know that you're going to really move the needle on this. And now when, you know, you start these listening sessions, as G said, and people are kind of wondering what it's all about and if it's another initiative that's going to come and go. And now we've established these really great relationships with all of our leaders, our hospital presidents, our VPMAs, and our chairs. And so it's a topic of conversation in a way that it wouldn't have been, I would say, 10 years ago, probably at most large healthcare organizations or any healthcare organization. So I think it's been really impactful to show that we are committed to this work and that we have a long-term plan to move it forward.
Yeah, it's interesting. I mean, professional well-being cannot be the flavor of the week in healthcare. It has to be something that is integrated into the organization and is sustained and long-term, because our workforce is really how we get things done, and will continue to be how the way we get things done for as long as there is healthcare to provide. I have one last question for the two of you before our Q&A session with the entire group. What opportunities for two-way communication did you create as you designed this plan? And specifically, how did you gather frontline staff input on the plan and then share the plan back out to your frontline teams? G, do you want to get us started on that one?
Sure. I would say that our whole program is based on a flagship program that we call the Scholars of Wellness, that we published on the AMA Steps Forward site for other healthcare systems to also be able to use. And it was designed around this idea of what you've been saying the whole time, nothing about me without me. And, you know, I've sat on more wellness committees than I care to share with you. And I felt like for a long time, they didn't do anything. And I couldn't figure out what the deal was. These are very smart, intelligent, passionate people. And you realize that wanting to do something good isn't going to be enough when it comes to changing systems. Changing systems require a certain set of skills and knowledge to be able to do that. And so the Scholars of Wellness program was designed to empower the frontline folks who know their work the best with those additional skills and knowledge to play an active role in workplace redesign in their local work environments. And what that also did was, when I was meeting with our chairs and chiefs, they said, hey, you know, can you help us make some of these changes? And I said, would you like a toolkit? And they said, I probably won't read it. And I said, great, I will give you a person. We will train a person that's an extension of us with our skills and knowledge, that has close connection, bidirectional communication with the Office of Wellbeing, so that you have a partner with you in this work and on this journey. And then that person always has access to us, and we can all stay really closely connected about what are the needs right now, what are the pain points. And that allows us, I think, to have a much greater communication from the ground up, so that we don't get disconnected, because that's something I really, really worry about. I see it a lot. And so for me, it's the desire to stay very close that we have tried to create with the Scholars of Wellness program.
Great. I love the idea of training a person, right? And that way that person can become the facilitator of the work. What a powerful idea. Jen, how about for you? What opportunities for two-way communication has your organization created in developing a long-term plan?
So I'd like to just highlight what G said, because I really do see our office. I think this is the most impactful work that we do. We act kind of like a translator, right? People can come to us, any clinicians, any champion can come to us and share whatever it is they'd like to share that they may not want to share throughout the organization. And we can bring that up in a confidential or anonymous way and voice any concerns there are. I'd also like to say that, you know, large healthcare organizations, I think we all know it's very difficult to communicate effectively. And everyone is trying to provide the best care for our patients, and nobody is trying to create burnout or, you know, reduce professional fulfillment for healthcare providers. And I think sometimes because we're so large, it's hard to communicate that effectively and for everyone to see that very clearly. And so our office, I think, has been really important to use the infrastructure of our champion program, figure out what's happening on the ground level for our frontline workers, and bring those concerns or wins up to our executive leaders. And similarly, hear that response or hear what the next initiative might be from a leadership perspective, and bring that information out and communicate that effectively. I think that you can't over communicate. We have a hard time in healthcare, and everyone is focused on a different aspect of achieving the same goal. So I feel like we do a really nice job. The well-being offices do a really nice job in being that repository of information and sharing why things might be happening to people based on what their perspective may be.
So this is really critical. It's a lens of how you're looking at this work and being able to interpret back to the healthcare workforce, some of whom may be really suffering, right, from burnout, from their own work determinants of health, and really provide that lens of, this is the work of the organization that's ongoing, and it's for you, and it's so that you can be fulfilled and also provide care in a safe and effective environment. And I think that lens and bidirectionally, that lens of also focusing the ongoing work of the triple aim, right, of the patient experience and the efficiency and the outcomes, to include that professional well-being is such a key component here. Thank you, Jen. I would now like to welcome to the stage Paul Rains and John Howard to join in a discussion for our closing keynote. John and Paul, welcome.
Thank you.
So we started our 3 webinar series with the 2 of you speaking about the importance of this work and your goals really for the country in the impact of the Impact Wellbeing Guide on the well-being of the healthcare workforce. John, why is well-being work so important, and why should hospital leaders use this guide?
Well, I think over the course of the 3 webinars, any of our attendees can answer that question. I think without me being a helper here, clearly for a number of different reasons, not only for patient care, not only for worker care, but not only that, but for population care. Because we're dealing with how all of us in our country maintain our health and well-being. And healthcare workers have a vital role in helping the rest of us maintain our health and well-being. And so the workforce and the workplace that healthcare workers find themselves in is vitally important. Because if you have the wrong policies and procedures, the wrong attitudes, the wrong programs, you're not paying attention to worker well-being, you're not going to have quality patient care, and you're not going to have quality population care. And, you know, when we look at the American healthcare system, it's a $4.4 trillion part of our national economy. 17% of our GDP is generated by what goes on in healthcare facilities. The BLS expects and predicts the workforce dynamics every year, and they project by 2026 that there'll be an 18 to 20% increase in the growth of jobs in healthcare. So we are preparing for a future workforce so they don't burn out, so they don't have anxiety and depression. They're not challenged by suicide ideation, and they're pleased with their job. They are providing quality patient care, and they're ensuring the health of the US population.
That's a wonderful vision for the future, John. Thank you. I want to work in that place. Paul, Common Spirit is the health system that the guide was piloted in, but there are organizational strategies around professional well-being, you know, before and after and during that pilot. So I was hoping you could answer the same question. Why is well-being work so important, and why should hospital leaders use the guide?
You know, well-being has always been important. I think we've looked at it in terms of burnout and how that affects our workforce. But and unfortunately, you know, to your point, it can't be the flavor of the week. It requires a cultural change in the way that we look at this. And unfortunately, oftentimes cultural change takes a significant event, right, to really drive us forward. And COVID, I think, was that event. We saw an escalating prevalence in anxiety and depression, substance use disorders, and unfortunately suicides. And that's what, you know, the Lorna Breen Foundation was born out of. It really led us to take a look at this through a whole different lens as an organization, understanding that if you know that we had a serious issue to address, and it had to be something. And you know, I want us to kind of create a new acronym for ISM. It has to be intentional, sustainable, and measurable. We have to be able to create something that is very intentional, and that we have the goal of it lasting, of this making a lasting impact. So for us, it was you know, we were looking at we partnered with the UC Berkeley Haas School of Business to assist us in doing kind of a reviewing literature on leading practices and best practices. And there is literature out there on certain things, but certainly not to the extent that we were dealing with this crisis, this post-traumatic stress disorder crisis around COVID. And it was, you know, the work of the NIH and NIOSH, you know, and the Lorna Breen Foundation. We're starting to see more research and more literature on how do you respond to something of this magnitude, right? So, you know, we've benefited from this work tremendously, and I think it's an evolving area that we will continue to learn and develop our, you know, we're going to be measuring, you know, how well are our staff responding. One of the things that was said, a couple of things that was said earlier, G said, you know, giving this to somebody and saying, I probably won't read it. You know, I mean, how true that is in healthcare. And then the examples of listening and responding to those factors, like the burnout, like the electronic health record issues and the amount of time and things. Listening is key, listening to our workforce and really hearing what they're saying. But then the challenge becomes, do they know that we've heard them? And how do we show that? So, you know, what we have done is at a system level, done our best to create a well-being initiative. But what the guide has provided us is that operational implementation at the level. We are a large organization in 21 states, 145 acute care hospitals, and I think well over 1,000 some clinics. And you know, how do we create a well-being initiative that really reaches into all of those areas and is felt? So that guide was really a great opportunity for us to to be able to look at, okay, we created this thing. How do we get it out there? And this is our vehicle for getting it out there.
Thank you. Yeah, and one of our goals in this webinar series is really for all of the participants who are here with us live, and then all of those who view the webinar series asynchronously, is to bring that guide to life in terms of how organizations are using it. So Paul, thank you to you and Common Spirit for being the first to implement and to test the guide. As we close out the workshop series, what final thoughts, John, do you have about how hospitals can use the guide to move their well-being work forward? And where do you see hospitals continuing to make strides long-term in this work?
Well, first of all, let me echo all the things that Paul said. Just a tremendous amount of information there that we all need to take to heart. And the one thing that I wanted to point out is his use of the word culture, because that's what we're doing with the guide. We're helping people change their organizational culture. And you know, when you go to any medical facility, I, as a healthcare worker, the minute or two I walked into a new hospital, I could tell imperceptibly, intangibly, what the culture of that place was, because it comes out in 1,000 different ways that oftentimes we can't really articulate, but we have a feeling about it. This is not the place for me. This is the place for me. And I think what the guide does is say, we can help you turn it into a workplace that everybody wants to be there. And no matter where your journey started, whether you're in the middle of it, the beginning of it, towards the end of it, I think you can pick up the guide and make some progress, because we're all in this together. And as I said before, it's critically important for the future of our country that we all participate in cultural change in our healthcare system. As you mentioned, Steph, you know, we have healthcare workers, as you say, challenged by getting up every morning and trying to improve the American healthcare system. But actually, that's what all of us can do, individually and collectively. That's what the guide helps us do.
Thank you, John. Paul, where do you see hospitals continuing to make strides in professional well-being long-term moving forward?
I think we have an opportunity to learn from all the folks that are here today and all the folks that are going to be engaged in this, and that will come to learn and discover these opportunities to create and implement their own well-being initiatives. I think we're on a journey, and I think it's going to become. I think it already has become a wave, a wave that is really rolling over us out of necessity, because we have to address these issues that we're dealing with the escalation and anxiety and depression and things. I am very fortunate to be a part of an organization whose board, our Common Spirit Health Board, sees this as a priority. And they have called it out, and they have asked for, what are we doing? When we first started this, we were in the midst of COVID early on, and there were so many different leading practices from many different markets around our system. And what we tried to do is bring those together and create the best of the best. In addition, looking at the literature and the research, that's been being done around this and measuring it. So I think hospitals have an opportunity to, they don't have to go it on their own. They don't have to reinvent the wheel. They have an opportunity to learn from what's been done. And certainly as we move down the road with outcomes measures and things about, have we actually reduced the incidence of burnout? Certainly prevented suicides. Hopefully, I mean, it's hard to say, did you prevent it? But certainly, we look at the number of suicides that occur, and we want to reduce that number. And we certainly want to let our staff in healthcare know that we care and we are doing something about this.
Thank you, Paul and John. And I'd like to echo your comments. And as we bring the slides back up, echo, Paul, your comment about not being alone in this effort. And John, your comment about all of us working together collectively to make this situation better. As we conclude our workshop series, I really wanted to take a moment to thank each and every one of you, from our speakers to our attendees, for being here today and at our previous workshops, because it is communities like the ones that we have built through this workshop that will transform the state of healthcare worker well-being. So while NIOSH and the Dr. Lorna Breen Heroes Foundation's Impact Wellbeing Guide is a fantastic tool to help you on the journey towards improving professional well-being, we wanted to share some other resources and ways to engage to continue this work beyond the 6 steps outlined in the guide. And there are some wonderful resources for you. So first, as you complete each step within the guide, there are customizable tools for you to share updates within your hospital, including posters, screensavers, and social media graphics. These resources are intended to help you build off of Action 4, which is communicate your commitment, so that you don't have to wait until all 6 actions of the guide are complete to share what you're doing with and for your staff. Your healthcare workers want to hear from you. We encourage you to access and download these resources on the action pages within the Impact Wellbeing site and to share progress with your staff along the way. We heard a lot about how people need to know what is happening in their organization on their behalf, and this is one way to do it. Second, the Impact Wellbeing campaign offers many resources for hospital leaders, but also resources for our nation's healthcare workers. And these include tools for helping to advocate for use of the guide, as well as tips for how to discuss moral injury at work. Please access these resources via the Impact Wellbeing site, and there are links that are being populated in the chat on how to access those resources. Last, we know how much this community loves to hear and learn from one another by your engagement in the chat and your wonderful questions. Please share your progress in improving professional well-being with us. You can go to the link in the chat at the Dr. Lorna Breen Heroes Foundation website, and we will review your case study for inclusion in our library of case studies available on Symphony, our platform for sharing professional well-being best practices. This is a way to help share how it works, where it works, and to help others learn from the barriers you've faced in your implementation and how you've overcome them. Finally, if you have any questions, please feel free to reach out to me at stephanie@drlornabreen.org. If you have questions about the feedback form, you can reach out to Claire. And to view recordings of the workshop series, please visit the Impact Wellbeing website, where the guide is found, and also these recordings will be housed. Take care.